is Nancy Mata. I am a family nurse practitioner student at the University of Franklin. At this time, I'm going to present a patient for a case study. The patient is Arun Patel. He is a 38 years old American Indian patient with a history of hypertension, type 2 diabetes mellitus, and generalized anxiety disorder. He's coming to the office today for a checkup. He states that he has not been regularly checking his blood pressure and glucose levels at home, that he feels a lot of stress due to his financial condition, which has contributed to his health problems. The patient declares that in the last month he has gained 15 pounds and reports fatigue and malaise. He also says that in the previous month he has increased thirst and urination. The patient reports that he is taking his medications as direct and does not miss a dose. He says that to improve his stress, he eats frequently. He also says that he sometimes has panic attacks which are exacerbated when he has family problems. He declares that he does not feel depressed and is not allergic to drugs, latex, foods, or the environment. His medicines at home are metformin 500 mg PO twice a day for type 2 diabetes mellitus, escitalopram 20 mg orally once daily for anxiety, and hydrochlorothiazide 50 mg once daily for hypertension. He says that he does not take over-the-counter medications. The patient reports that his mother suffered from hypercholesterolemia and diabetes and his father from hypertension. He declares that he is a graduate student. He only lives with his parents. He denies exercise. Also, he has a sedentary lifestyle. The patient denies the use of alcohol or nicotine. He also says that he has a girlfriend who is very emotionally supportive. He denies sexually transmitted diseases, and he says that he has never been hospitalized or had any surgeries. Mr. Patel is a friendly patient sitting at the exam table. He looks worried and a little anxious. He is cooperative, properly dressed, alert, and oriented. He answers all the interview questions and maintains eye contact during the interview. Constitutional, positive for a 15 pounds weight gain in 3 months, fatigue, and general malaise. Cardiovascular, he denies palpitations, shortness of breath, chest pain, history of blood clots, and claudication. In the genitourinary system, he denies difficulty urinating, painful urination, or changes in the urine. The vital signs are blood pressure 146/94, heart rate 75 beats per minute, weight 233 pounds, BMI 34.40, height 5'9", and the temperature is 37 degrees Celsius. Blood glucose last visit was 6 months ago, 142 milligrams fasting, and the A1C was 7.5%. Blood glucose on labs 1 week ago was 210 milligrams fasting, and the A1C was 9.3%. Home glucose monitoring 4 weeks ago, 218 random. 2 weeks ago, 220 random. The home blood glucose monitoring 4 weeks ago, 142/96, and 2 weeks ago was 144/92. Mr. Patel expressed a concern about his poor control of his blood pressure and blood sugar levels. He stated that he should have come earlier from his checkup, but that he had not come due to lack of time. He also expressed a weight gain, 15 pounds, and much anxiety about his health and financial condition. clinical suggestions suggest diagnostic number 1, uncontrolled type 2 diabetes mellitus, diagnostic number 2, uncontrolled hypertension, diagnostic number 3, anxiety, general anxiety disorder, and diagnostic number 4, obesity. Mr. Patel must make changes in his lifestyle to avoid cardiovascular problems and complications and the endocrine system. It is also recommended to start an exercise program to lose weight, a healthier diet that consists of controlling sodium, carbohydrates, and fats, and increasing the consumption of fibers. In addition, relaxation methods such as yoga classes and group therapies are recommended to control his anxiety levels. We also recommended that he start regularly monitoring his glucose and blood pressure levels at home. I would like to prescribe him some medications. The first medication is glipizide and metformin 2.5 milligrams over 500 milligrams, 1 tablet twice a day by mouth with meals, 30-day supplies, and 60 tablets and 2 refills. For hypertension, I would like to prescribe lisinopril, hydrochlorothiazide 10 milligrams, 12.5 milligrams, 1 tablet daily by mouth for 30 days, 30 tablets and 2 refills. For general anxiety disorder, continue with escitalopram 20 milligrams as ordered by his specialist. Referral to psychiatrist for monitoring of his condition and readjustment of medication. For obesity, Mr. Patel must attend a nutritionist for advice regarding modifications in his diet. The patient must come back for a follow-up and laboratory monitoring in 3 months. Thank you.